everybody. We are just waiting for a few more people to come in. Thank you very much for joining us. My name is Jill and I'm from the WALX HQ team, and this is one of our series of health webinars, and we're delighted that the topic this evening is going to be diabetes, and we've got a fantastic guest with us. We've got Neil Gibson, who's the Senior Physical Activity Advisor at Diabetes UK. In a moment, Neil will be presenting some slides, and then we'll be having a Q&A session with him at the end. And we're really delighted to have a mix of participants from WALX, interested partners, and also our instructors. So we've got a mix of questions. Some we've already sent to Neil, but we are inviting you to please pop those into the chat. We've put a little slide up so you can see how you find the chat and how you can put your hand up if you'd like to do that. So we're going to waste no time now. Hello, Neil. Thank you so much for joining us. I am now going to take my slide down, and then obviously you can pop your presentation up, and away you go. Thank you very much.
Thank you. Yeah, if you just give me a second to share my screen. I'm going to go straight into the topic, so hopefully everyone's in the right place, where we're going to talk about exercise and diabetes. I've tried to cater it for everybody, so whether you're have diabetes, whether you know somebody with diabetes, people at your sessions have diabetes, if you're an instructor, and so on. So yeah, I should just say hopefully you see me okay. It's a bit of a strange one on Zoom, and the light in the background is making me look like I've put a professional light up, which isn't the case. So what I'm going to try and cover today, if my computer works for me, we'll talk about diabetes in general, so maybe about 15 minutes worth, because I know some people won't have a clue, or they've heard things about diabetes and they're not sure, and so on. So I'll just cover some of the basics of diabetes. I should say that what I'm going to talk about isn't to make you into doctors or nurses or to be able to give specialist advice or individual advice. It's just more what I want from the session really at the end is for you to go away and think, well, actually, if somebody comes to one of my walking groups or one of my exercise sessions and has diabetes, it's not actually a big problem. It's not a big issue. And I feel confident in being inclusive for that person, and that I know what to do if there's any safety issues that arise. So we'll talk about diabetes in general. Hopefully you can see my mouse move as well as I go along. I'll then talk about diabetes and physical activity and relate it to the WALX. And some of the things I think you might need to know. And then we'll look at some of the kind of top tips and things that I think will help you out. And as Jill said, we'll have some time for Q&A at the end. So I've had some questions come through already, but feel free to ask in the chat. You might want to do it more near the end, because I'm sure some of the things will come up that I'm going to talk about. So in terms of what is diabetes, so this is as kind of as scientific as it's going to get today. So as I said, I'm not trying to confuse anybody. Or do too much here, but basically what you need to know is that it is a serious condition, and it's where blood glucose, which is also known as blood sugar, so blood glucose level, same thing as a blood sugar level, it's when it's too high. So the reason for that, or it's too high in your blood, and the reason for that is because your body doesn't make enough of the hormone insulin, or it might not make any at all, or the insulin it makes might not be effective or isn't effective. So if you don't have diabetes, what happens is you eat carbohydrate, and then the carbohydrate goes into your blood. And from there, the insulin's a bit like a key to the locked door of your muscle cells. It will go into your cells, the sugar will go into the cells, and that will help you move and so on and give you energy. However, if you have diabetes, when your insulin's not working properly or you don't create any insulin, the lock stays there. Or sorry, the key doesn't open. So it means that the sugar doesn't go into your muscles, into your cells, it stays in your blood. And the problem of that, it can lead to serious health problems, including death in extreme cases. So it's very important that people don't have acidic blood, they don't have high blood sugar levels. So with that, there's two types of diabetes that you might hear about, or the two main ones, so type 1 and type 2. So type 1 is when you don't make any insulin at all, and type 2 is when the insulin you do make doesn't work effectively. So you either don't produce enough of it, or it doesn't work effectively. There's also a few other rarer types that we're not going to go into too much detail today, but just in case you hear about them. So there's gestational diabetes that some women can get when they're pregnant. And then there's the rarer types as well of things like 3C, LADA, MODY, cystic fibrosis diabetes, Wolfram syndrome. So there's quite a lot of other ones, but we're not going to talk about them because they're a lot more rare. In terms of numbers, and apologies, I'm talking quickly, it's because I want to try and get through as much info as I can. So in terms of numbers, the majority of people that you meet will have type 2 diabetes. So it's around 90% of people with diabetes will have type 2. Around 8% of people will have type 1, and about 2% have all those rarer types I just mentioned put together. So in terms of actual numbers in the UK, I don't know if you'll find this surprising or not, but these numbers are going up year on year. So if you don't work with anybody with diabetes at the moment at your sessions, there's a good chance that you will at some point, because we know that over 4.4 million people in the UK have been diagnosed with diabetes. And then we also think that around 1.2 million are also living with type 2 diabetes, but yet to be diagnosed. And I'll come on to what some of the symptoms are in a minute. So how is diabetes treated? And again, I know I'm rushing through this because it's not for you to know all this stuff and revise it as medical. It's just, it'd be interesting, I think, for you to know the differences. So for type 1, the only treatment is to replace the insulin by using injections or an insulin pump. So if you hear something on the news or the media, these new stories of there's a magic pill that type 1s can take and they don't need to take insulin and so on, that's not true. You know, if you don't take insulin, you'll be very ill, you'll die. So people have to take insulin if they have type 1. Because they're taking insulin, they need to test their blood sugars regularly. So they can use what's called a finger prick meter, or they can use a continuous blood glucose meter. And I'll show you some pictures of what those look like. So for type 1s, they have to take insulin and they have to check their blood sugars regularly because the insulin will make your blood sugar levels fall. And that's because we don't want high blood sugar levels for the reasons I said before about your blood becoming acidic. So one of the problems you have for people with type 1 diabetes, or for everybody with type 1 diabetes, is the fact that trying to get in a healthy target range of your blood sugar levels is very difficult, because if it goes too low, which is caused by insulin, you can have a hypo or hypoglycemia. But if your blood sugar levels are too high, so it might be you have too much carbohydrate, you can get hyper or hyperglycemia. So that's when your blood sugar levels are too high. So it's very hard to get the balancing act right of how much carbohydrate you eat or drink to make sure your blood sugar levels go to a nice healthy target, but then how much insulin you have to then bring your blood sugar levels down. So you don't want them too low and have a hypo, but you don't want them to be too high and have hyperglycemia. And then just to make it even more difficult, and why it's very hard to give a lot of individual advice, and everything I talk about today is just general advice, is anything that's happened in the past 24 hours will also affect your blood sugar levels. So that could be, there's some examples here, there's exercise, if you're ill, stress, the weather. So anything in the past 24 hours can affect your blood sugar levels. So for some people, they can have exactly the same routine every day, and the blood sugar levels might go up. The next day, they could do exactly the same thing, but it still goes down. So it's not always a precise or exact science. So it's very difficult for people to manage their blood sugars into that healthy range. For type 2 diabetes, it's a bit different because it's a lot more individualized. So people should or will have an individual management plan for their condition with their diabetes healthcare team. So some people with diabetes, with type 2 diabetes, similar to type 1, will have to take insulin or take medications that can lower your blood sugar levels. However, some people with type 2 may take other medications such as metformin, and then some other people with type 2 won't take any medication or any insulin, so they can manage their condition with changes to things like diet, having a healthy diet, exercise, and so on. So type 2s is a bit more individual because it depends what medication people are on. So if you're not sure, you can just ask the people at your sessions, do you take any medication that can lower your blood sugar levels? And I'll talk about the why in a second for that. So with that in mind, not everybody with type 2 diabetes will need to test their blood sugars because they might not be taking insulin or any medications that can lower them. So they're not at risk of hypos or those low blood sugar levels. So you'll find some people that won't check their blood sugar levels. They don't need to, and hence they don't need to take any insulin. So they'll be the ones that can come to the sessions, and often you don't know, you might not even know they have type 2 diabetes because you don't see them needing to do any of those things. So just put this on so you've got a rough idea when you see these devices, because they often confuse people. So there's two main ways of testing your blood glucose level or your blood sugar level. So you can do a finger prick test. So here, a little needle will come out. You'll prick the side of your finger to draw some blood. You put the blood on the test strip, and you get a new test strip each time. And then you put it into the meter, and it will give you a number to tell you what your blood sugar levels are. However, what's becoming more popular now with the advancements in technology are these blood glucose, the continuous blood glucose monitors, where you can hold them up against a little disc. So often they're on their arm, and they'll give you the level. So here you can see that this person's 5.3. In terms of insulin delivery, so once you've worked out what your blood sugar levels are, you may need to, or you may need to inject insulin. And again, the two main ways for this are you can either use the cartridge pen. So here there's a needle, and you can administer it that way, or you can use a pump. So again, with the technological advances, pumps are becoming more popular now, and often you can now get pumps and the sensors that talk to each other. So the previous page was to test what your blood sugar levels are, to see what the number is, and then this is how you administer the insulin, depending on what your blood sugar levels are. So pumps, this is what you might see on people at the moment, or that they need to use. Pumps are fine to use for walks. There's no reason why you can't wear a pump, or you can't wear your glucose monitor. So all this technology is fine for people to wear. There's no problems there. And actually they're fine for most activities as well. This one here, just so you know, is for people with dexterity issues, so maybe arthritis. So it's one that can help people inject. We don't see as many of those. In terms of the symptoms of diabetes, so if you notice these in yourself or anybody, any loved ones, you might want to get them checked out for diabetes. So the most common symptoms are if you're going to the toilet to pee a lot, so especially at night. So if you're getting up 4 or 5 times a night to go for a wee, if you're really thirsty, so you're drinking, a pint of water, and then straight after you're having another pint, and you're doing that a lot in the day. If you feel more tired than usual, if you're losing weight without trying to, if you have genital itching or thrush, cuts and wounds take longer to heal, and blurred vision. So one of the Diabetes UK campaigns around this, we called it the 4 Ts. So if you're more tired, if you're going to the toilet more, if you're more thirsty, and if you're becoming thinner and you don't know why, they're some of the main symptoms of diabetes. So if you notice that in yourself or anybody else, just make sure you get yourself looked at. And the reason for that is because there's too much sugar in your blood, so your body's desperate to get rid of it. So it's making you go to the toilet more to try and get rid of it. And because there's too much sugar in your blood, you become a lot more dehydrated. So that's why you're having to drink a lot more, and that's why you become a lot more tired. What are the benefits of being active? So we'll move now on to more about the physical activity side of it, so because people often ask. So I put this one on first because it's one I think which is often overlooked. It's because people say I need to know about condition specific, or I've got somebody coming with whatever it might be. But exercise can benefit those with diabetes the same as those that don't have it. So it's all the same benefits in terms of cardiovascular health, the socialization, the mental health benefits, and so on. So you don't need to think of it as being, some special treatment. It does work for everybody without diabetes as well in the same way. Because I know people want to know about the diabetes specific, I've just put a few on here. So we know that being more active, and that includes walking, helps the body use insulin better because it increases your insulin sensitivity. So it means that people don't need to take as much insulin, which is a good thing. We know that insulin's a growth hormone. Being active also helps you look after your blood pressure. And we know that high blood pressure means you're more at risk of diabetes complications. So some of those diabetes complications are retinopathy, so problems with your eyes, nerve damage, which is a big one, obviously, for people being active. We need to make sure that they don't have big issues there. Kidney issues as well. So there's quite a few different complications. And then for people with type 2 diabetes, we know that being active can help improve your HbA1c. So HbA1c is how much sugar is in the blood over a 3-month period. So we can work out if people have diabetes or not. The HbA1c is over a longer period, over those 3 months usually. So we know that in some cases, this can help people with the condition go into remission. So by walking more, being more active, it can help some people go into remission. So it's not always the case, but sometimes it can. And some of the recent research as well has also shown that for type 1 diabetes, that exercise and being active can improve your HbA1c. So we've known that it can for type 2 for a long time now, but the research is now showing that for type 1 as well, it can improve your blood sugar levels, or it can improve how much glucose you have in your blood over a longer period of time. I've put this slide on here because obviously I'm talking to a lot of walkers, so it's really important that people look after their feet. And one of the reasons I'm bringing this up for the instructors as well, rather than just for people with diabetes, is the fact that what you wouldn't want to do, because we've already said, if you were paying attention to the slide a few minutes ago, I said that one of the symptoms of diabetes is wounds take longer to heal. Wounds and cuts take longer to heal. So it's a big problem for people with diabetes. A cut and a bruise can easily lead to infection if you have diabetes, because you have more sugar in the system, more chance of infection, more bacteria. So because if you have some sort of foot injury, that can easily lead to infection, which in severe cases can lead to amputation. So it's really important, if somebody with diabetes says to you, my foot's really sore, I'm struggling to walk and so on, that you get them to look at it and check it out, rather than say, well, come on, it's just it's just, you probably just got a little blister because we've been on a long walk, it's probably nothing, don't worry about it. So you need to make sure people are checking. So this photo is a picture to show that you should be checking your feet before and after a walk. So when you take your socks off or when you put them on, people should be looking at their feet. If they struggle to see the bottoms of their feet, you can put a mirror on the floor and get people to sit down and just put the foot over the mirror so they can see the bottoms of the feet. But make sure people with diabetes are checking their feet regularly. They also need to be washing feet regularly to get rid of that bacteria, and moisturising in between the toes for the same reason. Making sure that footwear fits properly, so you don't want any rubbing, any blisters, and make sure it's the correct footwear. So people need to go on walks, need to be in their trainers or their walking shoes, walking boots, and so on. And then keeping toenails trimmed to make sure that they're not digging in or going into any of the other toes as well. So with looking after your feet, very important. People with diabetes are at more risk of nerve damage. We know that cuts and wounds and blisters and bruises and so on take longer to heal and can lead to infection. So make sure that people are checking their feet and it's taken serious. If somebody says to you they've got a big foot issue, that they're struggling to walk and so on. Hypoglycemia. So I don't want to scare people off now with this page, but what you'll find is hypos. The people with diabetes will be able to take care, or should be able to take care of the hypos themselves, and will know what to do, or should know what to do. It's rare on your walks, especially the low intensity walks, that people are going to have hypos. It's very rare to see severe hypos, but I've got to talk about this for the next slide or two, because it's the biggest safety concern that people have, and quite rightly so with diabetes. The biggest problem is the fear of having a hypo. So I'll just talk briefly about what a hypo is and some of the things you can look out for. So hypos are when your blood sugar levels are too low. So it's when they're below 4. So 4 millimoles or less is when somebody's having a hypo. So low blood sugar levels, and it needs to be treated straight away. So what things make hypos more likely? So it would be if you've not eaten for a while, if you've not eaten enough carbohydrates at that last meal, if you've been doing a lot of exercise and you've not had the extra carbohydrate, or you've not reduced your insulin dose, if you've taken too much insulin than you needed, and also drinking alcohol on an empty stomach. And I put the one about alcohol on as well, because it's one where I know afterwards, often at places and community groups, you go for the social and you go for a drink or two or 3 or 4. People often get this wrong and think that, well, actually, your blood sugar levels are going to go higher because there's sugar in alcoholic drinks. So it means people's blood sugar levels are definitely going to go higher, but it's actually the opposite. They're more likely to lower. So alcohol causes your blood sugars to lower. But what are the symptoms for hypo? So it's important, if you're an instructor, that you know some of these. Basically, it's when people are becoming drowsy, a bit less responsive than they normally are, so they might take longer to answer the questions. If you see people phasing out a little bit, I've listed a few others here. So there's the trembling, the sweating, if people are anxious, if they've gone pale, hungry. So if people mention any of these to you, it's different for everybody. One of the issues you're going to have is a lot of these symptoms are similar to putting in a lot of effort to exercise, so it can be hard to see. But if you do see somebody becoming, like I said, a bit less responsive than normal, that's where you'd say to them, look, you might just want to check your blood sugar levels. And then they can check them and either say, yes, everything's fine, they're at a nice level, or they might say, oh, yes, they're below 4, I need to take some of my hypo treatment. and I'll come on next what hypo treatments are. And that's where you would just, as the instructor would say, fine, yes, there you go. You take your hypo treatment, everything's fine, hopefully. If they need help with their hypo, so if they can't take the hypo treatment themselves, you've had to administer it for them, or they've gone unconscious, they've passed out, that is known as a severe hypo. So that's where obviously they'll definitely need to help with a severe hypo, and I'll come on how to do that. If someone's had a severe hypo, they shouldn't exercise for the next 24 hours. So if somebody comes to you and says, for your evening session, I had a severe hypo this morning, you'd have to say, well, you shouldn't be doing any exercise with us now, until your blood sugar levels have stabilized more. So what to do with a hypo? It's not as complicated as it sounds, or as some of the marketing people try and make out. Basically, you need some fast-acting carbohydrate. So around 20 grams is usually enough. So if you're desperate, that could be putting a load of sugar into water and mixing it up. Usually the hypo treatment's different for everybody, what their preference is. But the main ones would be glucose or dextrose tablets, sweets like jelly babies, sugary drinks, and glucose gels. So a sugary drink can be Lucozade, the sugar version, Lucozade Sport, Coca-Cola, and so on. For the glucose and dextrose tablets, they're things like the Lucozade Sport tablets or other dextrose tablets you see in most of the high street shops. So in the supermarkets, in Boots, in Superdrug, they all sell them. So what I would recommend is putting them in your first aid kit. So if you're an instructor, have them in your first aid kit. They don't go off for quite a long time or out of date. And it's just handy to have for your own confidence, knowing that if somebody with diabetes who could have a hypo, if they forget their hypo treatment, so if they forget their can of Coke or whatever they might normally use, it's always handy for you to just know that if they need something there and then, you can give it to them. It's in your first aid kit. It's just a cheap packet of the dextrose, the energy tablets from the supermarket. So yeah, just keep an eye on the person if they're having a hypo and they're treating it themselves. So if they're treating a hypo, basically they're having the tablets or the sugary drink. But the people using that or doing that should be able to do that themselves. In terms of a severe hypo, so that's the one, as I said before, if somebody is just not responsive, the sugar levels have just gone far too low, that's where you'd have to put them into recovery position. If you have a glucagon injection, you can give them that. If you don't, you'd phone an ambulance. The ambulance will come, and the first thing they would do is give them a glucagon injection. And as I've said, if someone has a severe hypo in the past 24 hours, or if they have a severe hypo, they shouldn't be exercising within the next 24 hours. It's also worth mentioning that severe hypos rarely occur with people with type 2, and it's pointless trying to give them anything by mouth, any of the hypo treatments, because they just won't be able to swallow if they're at a stage where they needed help, if they're unconscious and so on. So that's the scary page over and done with. It's pretty rare for this to happen for severe hypos. Normally at the sessions, or I think pretty much nearly every session I've done before, people will say themselves, "Oh, I'm going to check my blood sugars because I feel a bit low." "Oh yes, I am low. I'll take some tablets, some Lucozade tablets, a can of Fanta, whatever. I'll wait 15 minutes, recheck. Yes, my levels have now gone to an okay number. I can carry on." So it shouldn't be something for you to worry too much about. But as I said, keep the fast-acting carbs in your first aid kit, and then it gives you a bit of reassurance as well. Just to add, chocolate isn't a good hypo treatment, so don't use chocolate. It takes too long to get into the blood. So although it's full of sugar, don't listen to anybody that tells you you should be using chocolate. I've just put this one on to show you, because this is one that often people either get confused over or don't realise, but blood sugar levels can also go up with exercise. So for most of you here, if you're doing walks, you'll find that blood sugar levels will lower, because walking and brisk walking is an aerobic activity. So things that are longer duration, lower intensity, which is most activities, you'd expect your blood sugar levels to lower. If you're doing things like stretching, they don't normally affect blood sugar levels, so they'll normally kind of stay plateaued. If you're doing anaerobic exercise, though, so if you're doing those short, sharp, powerful movements, such as sprinting, such as weightlifting and a lot of resistance work, you'd expect blood sugar levels to go up. So For walking, that might be if you're just doing, lots of some sort of training where you're doing lots of short walks that are going up hills and rough terrain, and if you're having to hold your breath to really power up certain places, then possibly the blood sugar levels go up. But for most of you, I can imagine for most of the walks, blood sugar levels you'd expect to go down as it's an aerobic activity. But I've just put this slide on to make people realise it's not a case of every time you exercise, your blood sugar levels will lower. They can also increase as well. So it just depends on the activity. And then things like, as I said before, anything that's happened in the past 24 hours can affect your blood sugar levels. So stress is one of the big ones you see in sports. So if you're doing something competitive, if it's something new, if there's lots of people watching you, you're feeling a bit stressed, that can make your blood sugars increase. So you can get activities that really confuse people of not knowing what's going to happen to their blood sugars. So you always recommend to keep testing. So something like golf can be a tricky one. So golf, you'd expect your blood sugar levels to lower because you're walking round. It's mainly walking to each hole. However, if you're somebody that's taking a lot of shots and you're kind of zigzagging up and down the course and having to do a lot of drives, because you're using that explosive movement, it's very powerful. If you're playing in a tournament or if you're playing with friends and there's the stress of people watching you, that can make your blood sugar levels go up. So it's hard to know what's happening with your blood sugar levels. This is just another way to show you to hopefully understand. So flexibility and stretching, you expect it to stay kind of fairly level with the blood sugar levels and blood glucose levels. If it's aerobic activity, so walking, brisk walking, we'd expect blood sugar levels to go down. If it's anaerobic, so those short, sharp, powerful movements like sprints and weightlifting, you'd expect to go up. And if you're doing a mixture of those aerobic and anaerobic activities, it can go up or down. So it's worth always checking. Slide, I don't expect people to know this or memorize it. I just thought it'd be useful as I'm talking now, just to see what the recommendations are, or what we recommend if somebody tells you their numbers. This isn't an exact science, so I'm sure there might be people on here with diabetes that say, well, actually, when I do some of this stuff, my numbers double that or completely different. But this is just a rough guide in general for somebody new to this to have an idea of what the numbers mean. So as we've already said, the most important one is if it's less than 4 millimoles. So if somebody says, I've just checked my blood sugar levels and it's 3.8, that's where they will need to stop and have their hypo treatment. So the hypo treatment is as simple as the sugary drinks, the glucose tablets, things that you will hopefully have in your first aid kit after tonight. But people should be bringing their own hypo treatments if they need them anyway. Again, if people have eaten beforehand, if it's not too much an intense walk, you wouldn't expect the blood sugar levels to drop that much. So I don't want to scare too many people. If they were below 4, you then want people to also have some starchy carbs after that. So things like banana or cereal bar to stop them going low again. So there's no point treating the hypo and then it gets to 4.5 or a bit higher. And then all of a sudden they're doing walking because it's just going to, drop again below 4. So you'd wait 15 minutes, check the blood sugar levels, and if they're at a safe number, they'll then be able to carry on with what they were doing. So 4 to 7, that's usually the healthy target range throughout the day. So when somebody with diabetes isn't exercising, you'd want ideally their blood sugar levels to between 4 and 7. If they're between 4 and 7 and they're about to start exercising, you'd probably need a snack before that just to make sure they don't go below 4. But again, everybody's different. So some people might say, well, I know when I exercise, I can start fairly low and not have a snack, and it doesn't go any lower on the walks that I do. And some people may say, well, I start very high, much higher than the numbers you've put here, because I know that my blood sugar levels will drop a lot quicker. 7 to 13s normally for exercise is kind of the ideal number that we say for people when they're about to start, in terms of not needing to have any food or take any insulin or anything else. And then above 13 is where it can start to become a bit dangerous. So again, it doesn't mean that people can't exercise or go on walks if they're above 13. It's just that's where we want people to start thinking about what they need to do. And again, it won't be for you as instructors to know about these things. It'd be for the people with diabetes to have already spoke to their diabetes team to know what to do when they're at certain levels. But it might be that they need to check for ketones. So we don't want the blood to become too acidic. But for a lot of people, you'd find that the blood sugar levels should start to drop. But if they're above 13 and they're doing some of the anaerobic stuff where blood sugar levels can rise, that's where it might become a bit of a problem. But for walks, it should be fine. So yeah, I don't want to go to too much depth on this one, but it's just to give you a rough idea of the numbers. And I can send these slides on to you as well if people want them. So I forgot to say anything that's highlighted or anything that's underlined means you can click on it and it'll take you to our website where there's a lot more information on all this stuff. So this is just a general recommendation. Please don't tell somebody if they say I've lived with diabetes for years and my blood sugars are 13.1. You say maybe you shouldn't start exercising. They'll know what to do. It's just the big one for you to know as an instructor would be less than 4. So if it's less than 4, people need to be they need to stop what they're doing to have the hypo treatment. So I'll just give a couple of slides of some of the tips that I put on. I'll just put them all on at once. Firstly, it's worth saying that it's important to make sure people are having regular contact with their diabetes healthcare team. As I said, it's not for you to be the doctor or the nurse. You're just there to hopefully have a bit more idea of what people with diabetes need to do. You need to encourage the participants to regularly test their blood sugar levels if it's appropriate. So as we said, not everybody with type 2 will need to check their blood sugar levels. Everybody with type 1 will need to, and some people with type 2 may need to as well. So the easiest way is just to ask people when they sign up or whatever to know, try and find out a bit more about what's their management plan, what's their treatment plan. And then you can read a bit more about it if you want to. The big one is just be aware of the symptoms of hypoglycemia. So as I said, if people are a bit less responsive, they're a bit more drowsy and so on, that's where you might want to say, look, you just need to check your blood sugars because you seem a bit less responsive than normal, or you seem to be having, a bit more shaky, a bit more irritable and so on. And that's then people can just check their blood sugars and then either say, yes, I'm fine to carry on, or, oh, yeah, you were right, it is a bit low, I need to have a snack or I need to have my hypo treatment. Always try and encourage people to have their fast-acting treatment. They should do, but obviously people may forget it, they may lose it and so on. So as I've said already a few times, I definitely recommend carrying it in your first aid kits if you're an instructor. And again, it's just something, it's very simple. You don't need to buy any specialist things called hypo treatment. It's just go to one of the local shops, the supermarkets, and buy the little glucose tablets you can get. There's quite a few different ones. Or just buy a little bottle of a sugary drink. This one's more the keeping carb snacks. That's more if you're doing like a weekender walk or some very long walks and stuff. Again, you'd want to encourage the participant to bring some snacks with them, a banana, a sandwich, some cereal, whatever it might be. But it might be worth, if you're doing it, or especially if you're doing it with children who can easily forget these things, is to bring some yourself, to just have if people are coming for some of the longer walks or the more intense walks where they may need a snack. It might just be worth you bringing some snacks yourself, some cereal bars, that sort of stuff. And then it's worth saying as well, none of this is an exact science, and we're still learning all the time. So we know that everyone with diabetes is different. So no two people, they might not use the same hypo treatment. They may have different outcomes. So a lot of it's trial and error. So if it's for people to work out what works for them and how long it takes, certain foods and certain things to affect them. Some people will react slightly different to exercises. So some people's blood sugars will drop a lot quicker than others. So this is just a guide that I've been talking about today. And then finally on this, just to say that the participants will know more than you, or should know more than you. So it's not for you to tell them and say, well, actually, I think X, Y, and Z. They'll know their own bodies. They'll know what numbers work for them. They'll usually know when to test their blood sugars and when to take insulin and so on. But where it's good for you, though, is to just make or to realize that people may need to snack during exercise. They may need to use sugary drinks. They may need to check their blood sugar levels. They may need to inject insulin. And the reason I put all them on here is because I've been to different sessions before where people, especially instructors, have made this into, a big deal. So it's about not making it into a big deal. So make it accessible for people to check their blood sugars, to inject insulin, to have a snack. Think about the questions that you need to ask, or if you need to ask them at all. So if it's more personal about people's health, then make sure you're doing it one-to-one with them, because what we want to try and do is eliminate stigma. So I think of an example, one of the recent ones when I was in one of the gyms and I had a personal trainer or overheard a personal trainer saying to one of the clients with diabetes, I can't believe you're having that kind of sugar after you've just done this exercise. You'll never get any of the health benefits. You're having a sugary drink. Why are you doing this? That's terrible. And then they had to answer and say, well, I kind of need it to live. So, yeah, don't make it into a big deal. People need to check these things, let them do it. They don't need you off, to fuss over it. They'll know what they're doing. Just let people check themselves. And as I've said, with that example, people may need to have sugary drinks. So none of the, things around, I can't believe you're having something sugary. You'll never lose weight if you eat sugary products, blah, blah, blah. Some people need that as their hypo treatment. That kind of links in with the next slide here about no specific dietary advice unless qualified. So that's unless you're a dietitian or a diabetes dietitian. So this is one of the big problems I see at a lot of sports clubs when I go to them, is people that mean well, they have a rough idea of healthy eating, but they try and apply it to people with diabetes and get it completely wrong and are telling them some very dangerous stuff. So what you think might mean well, of a bit like the hypo example, or you should never eat any sort of sugar, well, some people might need to if they're having hypo. So no dietary advice unless you're qualified to, especially around weight loss, because that's one of the big ones people get wrong again. So with that, it's worth remembering it's not just about weight loss. So yes, it's the biggest modifiable risk factor, is living with obesity. So being a healthy weight and maintaining a healthy weight is the best way to go into remission of type 2 diabetes. However, being active and exercise is not just around weight loss, it's all the other benefits I've mentioned before. And it's worth mentioning that you can be a healthy weight and you can actually be underweight and get diabetes. And you can also become a healthy weight, lose lots of weight, and you still have diabetes. So it's not as simple as if you're living with overweight, that means you're going to get diabetes, and if you lose lots of weight, the diabetes will just completely go. So if you think of like the example that's used a lot, Steve Redgrave, the rower, so he has type 2 diabetes. He was diagnosed at 35, going into his fifth Olympics. So someone that kind of healthy, the peak of physical fitness, got type 2 diabetes, and we don't know why. So there's still a lot of research being done on this. And then finally, I just wanted to mention around, because I know people panic, myself as a coach, if somebody comes and you're thinking, oh, what do I do with this person? It's a case of focus just on what they can do. So that's the easiest way to be inclusive. So with all the things I've talked about today, it's a case of you can chat to the person first, make sure that they're good with their diabetes, with their management, they know what they're doing and so on, which the answer pretty much every time is yes, they will know what they're doing. You can check whether it's before a session, especially if you're going on a longer walk, more intense walk, do they have their hypo treatment if they need it? Do they have their insulin if they need it? Do they have any sort of snacks? Do they have ways of testing their blood sugars? Do they have their blood sugar meter with them? That all goes into a bag, a rucksack, a bum bag, the pockets, whatever. They carry it with them, job done. So what I just want to finish with, I'll just quickly, because I want to leave time for questions. I'll just to say that, again, this was just a very quick whistle-stop tour to give you a better understanding of diabetes. But on the Diabetes UK website, we do have a lot of different pages around exercise and diabetes. If you want to know more information, we have things like the blood sugar level ones dedicated to that, where you can find out more details of that graph that I showed you. We do have a walking page, and then we have some other activities as well, such as swimming. We also have exercise resources. So we have posters you can download, videos, there's guides, there's lots of different things, all sorts of free things that you can download from our shop. Here's an example of one of the posters, and we have these in quite a few different languages that people can put up on their wall. So there's all different ones around. This one around sitting down and doing different exercises. And we also have our videos. So this is the YouTube page. So there's 17 videos on here when I last did this slide a while ago, so I think there's a few more now, but you can see there's all different timings if people want a quick 4-minute one, or if they want an 18 minutes and so on. So we have videos again that are free for people to follow and download, and there's a few with some celebrities as well. We have an interactive guide, so if you wanted to use this for people for a bit of motivation that have diabetes on your walks, feel free, you can download this for free. But it's an interactive guide where people can fill in different points and write stuff about where they're up to and how they feel, and they can see their progress over time. And it gives lots of top tips and ways that people can be more active. We do have a Know Your Risk tool as well. So if you're a bit worried about some of the symptoms I mentioned before, or you recognise it in anybody, you can also go and download our Know Your Risk tool. So that's 7 questions that give you answers to, what's your risk of developing type 2 diabetes? So 7 fairly simple questions for you to answer. and I'll leave it there because I'm just conscious of the time, and I think we'll have some questions coming in.
You have indeed. You have indeed. Thank you so much for that, Neil. We've been monitoring the questions in the background, and I think it'd be quite nice to move to some of the participants that have got direct questions. Somebody, Jill, was concerned that she's got LADA, and she goes for a run in order to manage that. And having seen some of your slides there, she's a little bit worried that she's not doing the right thing, because obviously it is running, not.
Sorry, I think you just broke up. That just me.
Oh, hello.
Yeah, are you there, Jill?
Yeah, I'm here.
Oh,
Yeah.
oh, perfect. Yeah, I don't know if it's me or you. It just froze slightly.
Yeah, it just froze.
Yeah, so I missed some of the questions. So she has LADA and she goes for a run.
She goes for a run.
Yeah.
And she's worried now, having seen your slides, that she might be doing the wrong thing, the wrong type of exercise.
No, so there isn't really a right or wrong type of exercise. It's what works for you in terms of sustainability. So unless you have severe complications, sorry, just to caveat that, so if you know you have a heart condition and so on, that's where you need to speak to your diabetes team and GP. But for somebody that doesn't have those severe complications, there isn't necessarily a one that you should or shouldn't be doing. It's what works for you, what you can keep doing, what's sustainable. So running's fine. So if you've not had any issues, if you're running and you feel fine afterwards, you know, your blood sugar levels are okay, you don't have any issues, don't have any, you know, blood sugar crashes or anything, then yeah, carry on with the running. If you've got no physical injuries, yeah, there's no reason why you shouldn't be running.
Brilliant. And one that came in to us from a lady called Karen that wasn't able to attend tonight, but was from one of our groups. She wanted to know, she keeps reading things about diabetics cutting carbs altogether, and she's saying she's not really understanding what a good pre-walk breakfast, because she normally walks in the morning, or meal would be now to sustain her glucose levels during a walk.
Yeah, so here again, here's where it's individual. So to answer the first point, which was around not having any carbs at all, it's not one that we would recommend at Diabetes UK. There are different diets around, so there's not one, again, a bit like last question, there's not one way over another. So again, it's what's working for you. So we know that for some people, low carb diets work, Mediterranean diets work for others. So there's quite a few different diets that work for people. So our advice is always, you know, if it works for you, then it's usually okay. It's the problem you have is when people, you know, if it's worked for them, it doesn't mean it's going to work for others. So there's no one size fits all, and it's where the marketing or where the food industry is a bit naughty with this, because they know that, but they will still push, you know, this is the way you must be doing it, you know, buy my diet book because this is the only way that you will be healthy, you will lose weight and so on. So if you know the low carb diet works for you, that's fine. Zero carbs, you know, just one of the big issues is just not sustainable at all to try and carry on with zero carbs. And then it depends what you're replacing those carbs with. So when I was saying about the no specific dietary advice unless qualified, that's where I see a big issue in the gyms, because often the big muscle men PTs will tell people, well, we're going to cut out the carbs for you, so we'll replace it with protein and put you on a really high protein diet. But for people with diabetes, high protein diets can be very dangerous. So we know one of the complications is kidney damage. So you don't want your protein intake to be too high. So for some people with diabetes, too much protein is very dangerous. But that's what some places will tell people. Oh, we'll replace it with protein.
Yeah.
To answer the second part of the question, it was around what to eat first. So I think there's a few examples I gave around some of the snacks. Again, it's hard to know with all the individual details, because you'd have to look at. So the first part of the answer would be to speak to your diabetes team. If you can get access to a dietitian, even better. But speak to your diabetes team, because they'll need to know, you know, how much insulin are you taking, if you take any at all, how long's your walk going to be, how soon are you going to go for a walk straight after. So there's quite a few different, you know, permutations that I would need to know, or they would need to know, rather than me to say this is the perfect food for you. Or because some people won't need to eat any food before they go for a walk. Some people are fine. So some people can get out of bed and not go. So with this lady, it sounds like trial and error would be a good one to see what works, what doesn't. But yeah, definitely speak to a diabetes team because there's too many variables for me to try and give you a safe answer.
And I think probably that one will tie into another one that we had from an instructor who has got a participant that's been put on the program, the retune plan, which is like a sort of a get started resetting plan, and I believe it's really low calories, and the instructor is quite concerned, should they be advising that this person comes when they're eating that low calories and they're not used to doing so.
Yes, so that one would depend on the program. So what the best thing for them to do would be to get the participant to speak to the program to see what they advise. So I know with Retune, so before Retune, it was called Direct, so it's like the precursor to that. And then they advise not to be doing physical activity when you're on such a low calorie diet because there'll be problems around energy and so on. So yeah, the participant would speak to find out what stage, because I know with the Retune study, it's at different stages. So when you first do it and you're on I think it's 800 calories per day, but then it moves on.
Yeah.
So then so depending on, because there's 3 different stages. So then you go on to the second stage where they start introducing regular or ordinary food, and you go back to eating regular food and not just the soups and shakes. So it would depend on what stage they're at. But yeah, you need to speak to the people at Retune to see what they advise, because again, it would depend on what physical activity they're going to do as well. So is it that they're going to go on a nice gentle walk for 10 minutes? And with that, they're allowed to then have certain extra bits of food, or they're going to be able to have certain proteins or whatever. Or is it a case of no, they're going to have the soups and shakes? They're at the stage where it's just the 800 calories, that's it, nothing else. And then they want to go on a nice long run or a very long walk. That's when it wouldn't be safe. So yeah, that's my long way of saying they need to check out with the people at the Retune study. But generally, yes, it is dangerous for people on very low calorie diets to be doing or too much exercise.
Yeah, and I think the instructor was right. The participant was keen to get going and make these changes, but they're going to try and do too much on that sort of calorie.
Yes, yeah. So from the participant point of view, I can see their end is, if I'm on this low calorie diet, so it's a region about trying to lose weight. So we know that losing weight quickly is the best way to go into remission of type 2 diabetes if you're an unhealthy weight. However, those people then think, well, yes, I'll also do lots of exercise because that's going to make me even fitter and lower the calories even more. But yeah, it leads to very dangerous to be trying to do exercise when you're on such a low calorie diet because you just don't have the energy. And
okay, fantastic. And then Tracy's asked a really good one, and thanks guys for all that people have been putting advice in the chats as well. So we're just trying to pull out the sort of relevant ones that Neil can answer, and then we will share as much as we can afterwards, and get back to anyone we might have missed. So I do apologize if we missed you. But what Tracy's asked is, when she goes for a cold water swim, she notices that really affects her blood sugar. She's not diabetic, but she wanted to know, does cold weather and cold water swimming, I presume, have an effect, as far as
yes.
you're aware?
Yeah, so a bit like I said before, that's where it gets very complicated, because anything in the past 24 hours can affect blood sugar levels, but weather is one of them. So where that's hot or cold, it can be different for different people, but normally, so hot weather or hot temperatures can make your blood sugar levels lower because your capillaries start to open up in the heat. So it means insulin gets into the system quicker. So it means that your blood sugar levels can lower. So that's why where you might see the signs on like the sauna and jacuzzis and steam rooms that say about, if you have diabetes, check with your healthcare team first, because they know that hot weather is going to make the capillaries open up and cells open up, and the insulin can get in quicker to lower blood sugars. But similarly, cold water can have the opposite effect, so that can make them rise. But then there's different scenarios where it can lower as well. So it's a very confusing one. But yes, it can, the cold water swimming can definitely, so hot or cold weather and temperatures will definitely have an effect on your blood sugar levels. If you don't have diabetes, it should just normally regulate itself. So your body will know our blood sugar levels are fairly high. I'll release X amount of insulin, or my blood sugar levels are too low. I won't release any insulin. Whereas with people with diabetes, that doesn't happen.
Right, fantastic. Okay, and then we've had a couple of questions around. Tracy again asked, you mentioned glucagon, and somebody's already answered actually to say it's very unlikely that people would have that with them, and they would normally have their insulin or glucose tablets and various things with them if they're managing their own condition. So is that something that instructors need to read up and be more aware about, or is it not something that happens a lot?
It's not something that happens a lot, so that's why it's a bit of a hard slide to show, because it's one where I have to, because that's the biggest concern and the biggest worry of something going wrong is that panic if someone has that severe hypo, but the chances of it happening is low. And then it depends who's at your session. So normally if you're not with children, so it's older people that have lived with this for a while, you'd expect them to be able to manage it usually a bit better unless they're newly diagnosed. As I said, there's quite a lot of type 2s that don't take medication that can lower the blood sugars, so they don't have to worry about the hypos and severe hypos. But yes, it's one where people don't carry the glucagon with them because normally it's not needed, because you'll notice yourself, oh, I feel a bit dizzy, I'm a bit tired, whatever, I'll check my blood sugar levels, oh, I'm below 4, or and whatever, I'll have a little bit of, I'll take less insulin, or I'll have more carbohydrate, or if it's below 4, I'll have that fast acting carbohydrate. The times when it goes wrong is if you don't have that equipment, and then it's hard to know what levels you're at, and then that's when people can have a severe hypo.
Brilliant, thank you. And then there's some great advice. Catherine said that as a type 1 diabetic, she finds eating veg and protein before her carbs helps her to reduce spikes in her blood sugar. So, and that's eating a meal. It's not related to exercise, but she's just shared that. And there's a great question came through prior to this, Neil. Is it still all right for people with diabetes to complete things like our long distance challenge walks and events? Is there any reason they shouldn't?
No, they're completely fine to do it.
Yeah.
Again, the caveat to that is just, well, it's the same as people without diabetes, is if someone has serious and severe complications, that's when you need to make sure it's appropriate. So like I said before, if someone has a heart condition and so on, but for someone who's generally healthy, they just happen to have diabetes, there's no reason why they can't do endurance events. And as I said before, there's quite a few sportsmen, people like Steve Redgrave and people, athletes that do these things. It's fine. The only advice would be just make sure if you need to check your blood sugars, you have all the stuff we've already mentioned. You have your hypo treatment handy. You have your monitors to test. If you're new to this, you just test more regularly, and you'd want to work your way up. So we wouldn't want somebody to go straight in to do an endurance event of however long it is. You'd want to build it up slowly to say, well, let's do half the distance. And then before that, do a bit less. And so you want people to gradually build up and up and up. And then what I would say is just on the day of the event as well, is don't change your routine. So don't start trying new carbohydrates or new, whatever your strategy is. Don't be trying the new energy gels or eating at different times because you don't know how your body's going to react. So if you know what you're doing, don't then be tempted on the event day to then really mix it up, because then you can get stomach cramps and so on if you don't know how your body's going to react. So just work your way up slowly to the long event. But there's no reason why people can't do long events, endurance events.
And just be careful if they get blisters, I'm assuming.
Yes, and it's just what we've already talked about. So it's just having those strategies in place for long events. It's just making sure you have your equipment ready and you're testing your blood sugars. Often it's very easy now for the blood sugars to test them, because people will have the discs ready, so you can just, if they're walking along, can just hold the mobile up or hold the monitor up, and it'll give them a fairly instant reading of this is what your levels are. And if you've been doing it fairly regularly, you'll get to see the trend of all my blood sugar levels are slightly going up or slightly going down or are staying fairly steady.
Okay. And actually that you mentioning that most people or a lot of people now have got the much simpler without the finger pricking. And I think somebody said in the comments that they can actually set an alarm on those as well. And it might be a good idea if people are worried about somebody within a group having a hypo, that they can actually have a hypo alarm. Is it, I
Yeah,
think
that's true. Yeah, so you can
scanning
set
through
alarms.
really
So
quickly.
yeah, so parents love it because like when kids go to sleepovers or away for the night, they can check it on their own phone. So if the blood sugars are going low and the alarm goes off, it can go off on other people's phones as well if you want to set it up that way. So I know parents love it because then they can phone up and say, "Oh, can you check your blood sugars because it's come up on my mobile saying that you're going low or whatever." So the kids don't like being checked on like that, but yeah, the same principle. If someone in the group wants to share it with others, that's a yeah good idea for the alarms.
Yeah, that's fantastic advice, and that's a really good thing for instructors to know as well, that they could, if they are concerned, they could say to people, could you make sure you've got the alarm on if
I could see
they've
it
had
being used.
someone.
Yeah, I
Yeah,
could see it being really useful in for walking if you're on one of these walks where people don't necessarily always stick together. So if it's one where I don't know some sort of race and people are someone's at the back, someone's at the front, and you're not near others or near the instructor, or you're in the middle of a forest or whatever. I think that's when it might be a handy one, yeah, to set the alarms.
yeah, fantastic. And I have to say the moving more guide that you referenced, that's a really good guide, and I would advise anybody to download that and have a little look at it. It's full of great information, whether you're an instructor or participant, or whether you have diabetes, you don't have diabetes, you've got family with it. It's just a great little guide, and the resources on the website, which somebody else has also commented, are really useful. So get yourselves on there. Most of the stuff that Neil has shared, you will find on there, will you, Neil?
Yes, yeah, and in this presentation, I can send it to you, Jill, and you can send it on. But you'll see all the stuff. You can just click on all the links, and it'll give you more info on anything you need to know.
Brilliant. Well, my email for anyone who I will share it with our instructor database. Anybody else who's got any questions, would like to sort of ask anything further from this session, my email is jill@walks.co.uk, and that's Jill with a G. So please do let us know if there's anything else that you want. I think that wraps up the questions. Have I missed any, Martin or Dennis? I know you're looking in the background as well. Have I missed anything vital that you think
No, I
I
think I
haven't
think
picked?
I think a number of comments and advices have come through, and people, I'm assuming, have been reading it as it's come through. I don't think there's any significant questions missed.
Thank you. So all that leaves us to do is to say thank you so much for giving us your time and your expertise, Neil. That's absolutely fantastic, and I think that's helped a lot of people. And thank you very much, and we'll see
Uh,
you again, I hope, soon.
yeah, and thank you all for joining me tonight.
Thank you.
I'll let you
Very
enjoy your
much.
evening
And
walks.
yeah, thank you. We'll invite you out on one of our walks.
Excellent.
Yeah, see you later. Thank you,
Bye now.
everyone. Thanks for attending, and we will share as much information as we can with everybody who came through. And please do contact us if you've got any further questions or we did miss your particular question. And on that note, we aim to finish on time, and we've managed it once again. So enjoy your evening, everybody. Bye-bye.
Bye now.
Bye.